All right, then. I think now is a good time to start. So again, welcome to everyone who's joined. I'm Devin. I'm one of the moderators for this panel discussion this evening. I'm the research lead at One Day Africa. Since this is our second event in the mentorship series, I thought I would start off with a couple just updates from the previous one for anyone who's been following along. But before I do that, I think I'll just introduce One Day Africa for anyone who would like to, who needs an update, or anyone who's not completely familiar with our work previously. So One Day Sooner is a global medical advocacy group that was started in early 2020, particularly to advocate for human challenge trials to combat the coronavirus pandemic. This kind of group grew for about a year, but in the beginning of 2021, we realized that it was necessary to start a breakaway chapter called One Day Africa, dedicated towards medical advocacy on the continent. So our primary focus or goals for the chapter is to promote a self-sufficient medical system across the continent, both in terms of practical or clinical medicine, as well as in the more academic sphere of medicine. I think the latter is probably what would be maybe of interest to this group. Most of you, I believe, would be university students, but I would like to wish a warm welcome to anyone from any sphere of the medical community across the continent. All right, with that out of the way, I would just like to again go through a couple quick updates. So similar to last time, I would just like to point everyone firstly towards the Google mailing list group that we, sorry, I see Swerny has raised their hand. Swerny, would you like to ask a question quickly? No, all right, Swerny, please feel free to raise your hand again if I'm mistaken for moving on. But anyway, please do join the Google groups that I've put in the chat. That is our primary mode of communication with the attendees of this mentorship series. And I think in the next coming months, it's where we'll be communicating a lot on our future plans. One of which is that today we'd like to announce that for the final events in the mentorship series that would likely come towards the end of September, we are planning to host a poster session for all of the attendees of this kind of mentorship series, particularly with the goal of highlighting your work. I think throughout the previous mentorship event, this one and the third one that is still to come, you would have all heard from many experts across the continent. But I think it's also important that these events help give you all a platform. So we'll be communicating more formally in this respect in the future. However, I would just like to again point everyone towards the Google groups, which is where we will be announcing this event. And then, yeah, please be aware that towards the end of September, we'd like to have a poster session where you can all make posters to share your work among each other and the broader African medical community. And I think our goal is to get some of the panelists back and some other experts from across the continent to visit and maybe give some advice at that panel event, and also to provide some, maybe further incentives. I know that One Day Africa is going to likely want to host some of the posters that are the best following that event. So that is the first update. And then secondly, as a part of I guess promoting the mentorship series, we would like to create a promo video between One Day Africa and UNZAMEDSA. So please, if anyone is interested in helping us just by maybe shooting a 30-second video, please do get in contact with me. I'll put my email address in the chat in the coming minutes. All right, with that introduction and those two updates out of the way, I will pass it over to Sumi to begin the panel discussion. Thanks, Sumi.
Great, thank you, Devon. Good evening, everybody. Once again, you're welcome to the second event in the One Day Africa and UNZAMEDSA mentorship series. So we'll go straight into it. My name is Sumi Mukuka, and I'm a fifth-year medical student from the University of Zambia, and I'll be your co-moderator for this event. Okay, so I'll start by introducing our panelists, and then we'll go from there. So start with Dr. Jonas Chanda. So I'll just quickly go through his CV so that you guys can get to know him a little bit better. So Dr. Jonas Chanda has a Bachelor of Science in Human Biology, an MBCHB, a postgraduate degree, as well as a Master's in Philosophy. So he's a medical doctor who graduated from the University of Zambia School of Medicine, Ridgeway Campus, in 1998. So his professional history includes
All right, it seems that we have lost Sumi. So I will just jump in quickly. Sumi, can you, before I do that, can you hear me? No, all right. Okay, so again, we're introducing Dr. Jonas Chanda. So his professional history includes the fact that he is a medical doctor, where he received his training in Zambia. He has also been a national president of the Resident Doctors Association of Zambia. He was the senior technical advisor at Columbia University International Center for AIDS Care and Treatment Program. And he has been a member of parliament, where he was primarily chairman of the Parliamentary Committee on Health, Community Development, and Social Services. I would like to emphasize that his pedigree and his bio is far longer than that, and probably far too long to read appropriately here, but those are just some of the highlights. The second panelist I'd like to introduce is Dr. Mukape, and he is a medical doctor, lecturer, and researcher. He holds a bachelor's degree in human biology, a bachelor of medicine, and a bachelor of surgery, and a master of science in human anatomy, all obtained from the University of Zambia, the highest learning institution in the country. Dr. Mukape is currently in his final year pursuing a Master of Medicine in Obstetrics and Gynecology at the same university. Parallel to his M.Med program, he is a specialist registrar in obstetrics and gynecology at the Women and Newborn Hospital University Teaching Hospital in Lusaka, Zambia. Furthermore, he is a lecturer, researcher, and mentor in human anatomy at the University of Zambia School of Medicine and at the Cavendish University Zambia School of Medicine. As a clinician training to be a specialist in obstetrics and gynecology, one of his core duties is not only to provide care for patients, but also to tutor and mentor undergraduate clinical medical students rotating in the Department of Obstetrics and Gynecology. Sumi, are you back? Would you like to take over for Dr. Wala?
Yes, just give me a second. Okay, so I'm sorry about that. I had a little bit of a disconnection. Okay, so Dr. Wala is a resourceful medical doctor with an MBCHB. She's a health programs manager with over 15 years experience in health programs design, management, and implementation. And as a result of that, she has been a key contributor to the development of several guidelines, health bills, and health sector policies. So Dr. Wala is also an accomplished leader and excellent communicator. She's fluent in both English and Swahili. She's also well known and respected for program refinements and building credibility and partnerships with leading national and international health sector stakeholders, as well as NGOs. And so these stakeholders include the Ministry of Health, county governments, the World Health Organization, the IFC, the World Bank, the IntraHealth, UNFPA, as well as Gavi. So you're welcome, Dr. Wala. Hello, am I still audible? Devon, can you hear me?
Yeah, we can hear you.
Okay, great. So welcome again to all the panelists and as well as all the attendees. We're excited to have you here. We're excited to have this chat. So I'll go straight into it. Okay, so the first question is, how are you able to express your passion for medicine in a political or business setting? Is it particularly difficult? And if so, how are you able to navigate through the difficulty that comes with that balance? So Dr. Chanda, would you like to answer this question for us?
Sorry, just a second. I'm trying to turn the camera on. The
Sure,
video.
no problem. Okay, so maybe as Dr. Chanda is trying to work on his video, I could also throw the question to Dr. Wala. Dr. Wala, do you think maybe you could help us with this question? So the question is, how are you able to express your passion for medicine in a political or business setting? Is it particularly difficult? And if so, how are you able to navigate through those difficulties?
Thank you very much, Sue. I'm very happy. Greetings from Nairobi, Kenya, where I'm based. I think one of the things that my bio may not have mentioned is that I do other things apart from medicine. I am currently running a travel platform. And so I think for me, it's been about using my social media platforms to communicate social ills or to communicate issues about public health. And with that, I've found that there's a niche or there's an opportunity to have health in almost all sectors. So with time, and this is what I've really been pushing for in my global health career, is that health is not a standalone discipline, but that it should be, there's that slogan that says health in all policies. So whether it is a business policy, if it's an education policy, if it is a gender policy, there's an aspect of health. And I think my challenge has been in my undergraduate training, which was between the year 1996 and 2002, we did not have these other public health aspects of training. So we were trained to be clinicians and not to be public health or global health kind of experts. So I think this current generation has an opportunity to integrate medicine as we traditionally know it as with all the current affairs that is happening. I think as doctors, or as undergraduate medical students, we need to be exposed to things like how do we plug into conversations around politics, around bill making, regulation making, because all this affects us in how we interact with our patients and how we execute our medical training. So I think you guys have an opportunity to start that integration quite early enough. Because for those of us who started doing it well into our careers, it's been a steep learning curve. Thank you.
Thank you for that answer, Dr. Wala. I think especially with the recent COVID pandemic and just the recent happenings, we've learned that health is more than just about, being in the hospital and practicing medicine in the hospital. And so thank you for that answer. Dr. Chanda, are you there?
Yes, I am. Yeah, you could just probably repeat the question briefly.
Okay, no problem, doctor. So the question is, how are you able to express your passion for medicine in a political or business setting? Is it particularly difficult? And if so, how are you able to navigate through those difficulties?
Yeah, no, thank you so much. I think firstly, I just want to thank you for inviting me to speak, on this very, very important event. And then, of course, because I've been a politician, in fact, I am a medical doctor politician. So in terms of navigation, probably it's much easier for me to talk about. It's much easier for me to talk about. You can still hear me?
Yes, doctor, we can hear you clearly.
Okay, yeah. So I think for me, in terms of navigation, firstly, it's the view of the world. How do you view the world? I think my philosophy of the world is that no human being is standalone. You're not an island. We all belong to society. And if we belong to society, it means we have to be relevant to that particular society in every setting, whether you're in the urban areas, the rural areas, you're in a developed country, an undeveloped country, you have to be relevant. So that is the philosophy. And then two, just look at politics, because normally, politics carries a connotation of, a very bad meaning, because, like you've heard of sayings like politics is a dirty game because of the players. So the game itself may not be dirty, but the players who who have dominated politics over the years in history may have been dirty, so hence that name. And I know that a noble profession like medicine, normally very few medical doctors would venture into going into politics because of the nature of our career. Our career is full of medical ethics, full of integrity. You know, we are dealing with matters of life and death, which runs contrary a lot to the popular opinions about politics. But I've always looked at politics in a different way, as a vehicle, you know, towards service delivery. You know, it's the only vehicle in a country that you can use to deliver whatever services that you want, whether in the health sector, in the educational sector, agricultural sector, because there has to be a policy maker, someone to make these policies, to allocate resources, what we call budgeting, and then the technocrats at the tail end. So to me, that is the navigation. And that is why, starting from when I was a medical student, like my colleagues that we're addressing today, I was very actively involved actually in UNZAMEDSA, you know, the University of Zambia Medical Students Association, which later on became a union. In fact, I'm former publicity secretary of that. I used to lobby for students, my fellow students, yeah, you know, whatever was needed. And when I became a medical doctor at Kito Central Hospital, it was the same. I became a resident doctor association of Zambia branch chairman for Kito Central Hospital, because in those days, when I started working in 1999, we had severe shortages of basic health, you know, medical services in the hospitals, drugs, basic drugs, gloves, cannulas, drips, you know, just the basics. So someone had to speak. So I started at Kito, you know, while working as a clinician, but also advocating for these services. Eventually, my colleagues, I think in the big hospitals like University of Zambia Teaching Hospital, University Teaching Hospital, Ndola Teaching Hospital, Kito Teaching Hospital, they also it fit for me to be national president of the Resident Doctors Association of Zambia. So actually, contrary to what I had thought, it was more imposed on me rather than me going to be RDAZ national president. But again, even when I became RDAZ president, I remember lobbying the then Minister of Health, you know, Mr. Enoch Kavindele is still around, former Vice President of Zambia. I was lobbying the directors in the hospitals, permanent secretaries, just to allocate more resources to the health sector. Of course, conditions of service for the doctors. So that has been my view of politics. Basically, it's a vehicle, a tool that you use, you know, to make sure that you have enough resources to the health sector. As you know, most of our countries, Zambia and many African countries, we are signatories to their budget declaration. You know, their budget declaration says we should allocate 15%, at least 15% of the national budget towards the health sector. But you can agree with me that that goal is almost unachievable in most African countries, including Zambia itself, where we've been at 8%, 8.5%. So because the ones who determine the allocation of that amount of budget are the politicians in cabinet, the policymakers, the ones who make the laws in the country that govern the health sector, that is now leadership and governance at parliament, you know, that is legislation. So I've been privileged to serve both as chairman of the Parliamentary Committee on Health, Community Development and Social Services, and also to serve on the policy side as Minister of Health, yeah, you know. So looking at everything from being a clinician, being a technical person, having run programs, you know, in terms of international public health in different countries, you know, being an advocate, a lobbyist. I think it's a totality. So for me, the navigation is that we should have a realization that politics is just a vehicle to ensure that the major outcome that we want is done, which is good health services for all, you know, that is universal health coverage for all without leaving anyone behind. And that is the vehicle. So I think that has been, it's not easy. There are challenges I'll talk about later, but that has been basically my philosophy, to look at politics from that angle. Thank you.
Thank you so much, Dr. Chanda. That was a very insightful response. I think a lot of us needed to know how politics actually can be used to actually improve the health sector, given you know, the right intentions. Okay, so I'll also allow Dr. Mukape to have a go at this question. So Dr. Mukape, again, how are you able to express your passion for medicine in a political or business setting? Is it particularly difficult? And how are you able to navigate through some of the difficulties?
Thank you, Somi. Thank you to everyone, my fellow panelists. I think it's an honor to be among the panelists with the Honorable former Minister, Dr. Jonas Chanda. Thank you very much. Now coming to that question, I think for me, I'm more in the academic world. I think politics, I think Dr. Jonas Chanda has already put it that for us medical doctors, because of our ethics and so on, we tend to shy away from politics. And I think I won't comment much on that point because I'm not much involved in politics. Yeah. Thank you very much.
Okay, thank you so much for that response, Dr. Mukape. Okay, so we'll move on to the next question. So our next question is, what are the reasons why you chose your specialties? Do you have as much free time as you would like? As well as how do you balance your personal interests or any additional interests that you have together with clinic and academic work? So I think Dr. Mukape, you can try to answer this question first, then we'll ask the other panelists as well.
Okay, thank you very much, Somi, once again. Yeah, so how am I able to balance academic as well as the work that I do in OBS and GYN, for instance, the clinical work? Yeah, so, and I think the other question was, how did I end up being, an academician as well as a clinician? So first and foremost, I'm a lecturer. I've already been introduced, human anatomy. For me, human anatomy is to my heart, so to say. I enjoyed human anatomy very well, very much, as well as even, even just the practical aspect of human anatomy. I think every medical student, every doctor knows that human anatomy is at the center of medicine, so to say, in the practice of medicine. So for me, it was a challenge to venture into human anatomy, knowing the body from head to toe, front to back, inside out, and I enjoyed that. I think it was one of the best courses that I'd undertaken. Yeah, so I decided to do masters in human anatomy, and also to contribute to the university as well as just teaching and mentoring students in the field of medicine. I took it as an opportunity for me to to teach human anatomy to various students. As you know, anatomy cuts across almost all programs within the university medical college or medical school. Yeah, so for me with anatomy, it was about passion, about passion, and also just that prouing back to the community in terms of teaching students. Yeah. Then coming to obstetrics and gynecology, OBS and GYN, again, a wonderful course. I think I also love obstetrics and gynecology, seeing mothers coming and going back with babies and so on. So I think it's fulfilling. Yeah, of course, there are challenges here, there. Sometimes we have maternal death, but I think overall it's fulfilling. It's a course that you enjoy because you are able to see someone going back happy. Yeah. Now again, the other thing to consider that I considered with obstetrics and gynecology is that I looked at how I can be of importance to community, as well as also to establish myself easily once I finished the program. Being an academician this side, I needed also to do some clinical work. So I decided that I'll do OBS and GYN because I think I'll find it easy outside clinic. I mean, in private practice, so to say. So in private practice, I think it's much easier. I can set up maybe even a private clinic or just working in private practice. Yeah. So I think it's about combining the opportunities and also where one happens to work from. Yeah, so for instance, when I finished my junior resident medical officer, that is internship, I went to Kanyama First Level Hospital, where I became a senior resident medical officer. And there I found myself in the Department of Obstetrics and Gyne. And so I developed interests in that field. Yeah. Now balancing the time between the two, it's about, dedication, it's about planning. I think it's a key. You have to plan what you're going to do. Probably 6 months, 1 year, you plan, and then you stick to your timetable or your plan. Yeah, I think I'll give chance to others to answer. Thank you.
Thank you, Dr. Mukapi, for using your passion to give a service back to the school that you had come from. I think a lot of us that are your students, myself, that have been your students, and even those that are watching have definitely benefited. So we're definitely grateful for that. So I think I'd like to direct this next question to Dr. Wala. So Dr. Wala, what is your favorite thing about working in public policy and governance, as well as running a business? And why do you think that medical students should look into a similar career path?
Thank you. So I think in terms of social impact, so in terms of population change, and I think there's a space for those who are doing clinical practice. When we're being trained, we're told this is the only way, the clinical practice. And I think for me, I really struggled with that because I was always someone who thought without the box, right from undergraduates all the way to current situation. So I really battled because, my mom was like, I took you to medical school for 6 years and you're not seeing patients. Are you still a doctor? I get people, even my own children, ask me. I remember my son wrote in one of his compositions, I think he was like 5 years, he said, my mom is a doctor and she used to treat people and she'd give them medicine and they'd die. And that is why now she's working in XYZ organization. At that time, I was leading the Doctors Association here. So I think there's a lot of, in terms of career discussions within our undergraduate students. And I'm glad that this is a platform that's bringing doctors who are in different spaces to just open up opportunities and discussions around what else can you do as a doctor. For me, once I understood that, because it's very hard to go against the grain when everyone else is saying, oh, I'm gonna be this and that. So once I understood that it's okay to be me, it's okay to follow my passions, it's also okay not to know what you're going to be doing 5 years from now. So there are those people who are very well structured and they're very, career driven and they know what they're going to do even 20 years from now. And then there are those of us who wake up one day and decide, oh, let me try this other new thing that has come on board. What I will just advise those of you who are maybe like me is that have some accountability partner, because it's very easy to hop from one place to another. I was just recounting the other day that I have had, I think 7 or 8 employers, 7 employers in the past 18 years or so. And all these employers have been in very different fields. So I started with clinical work, which I did for 6 months and knew this wasn't it for me. And then I moved into research. HIV vaccine trials at that time were quite the it. And then for 5 years, and then I moved to the pharmaceutical sector. In fact, this was very tricky because people will be like, did you do medicine or did you do pharmacy? So just understanding what doctors do in pharmaceutical companies is very important. And then I moved to advocacy work and then NGO work. And finally, now I'm doing my own things. So I think it's important to just be exposed. I know in undergraduate, I was very keen in just understanding what else is there. And it's okay to be curious about what else is there. And I know of some of my colleagues who actually dropped. There's a couple of them who are pilots right now. So those ones are not even in the field of medicine. Some of us, we can still claim there's a bit of public health in what you're doing. So it's okay to not know what you want to do in the undergraduate. It's okay to also know what you're going to do 10 years from now. Just try and identify what your own personality is, what your passions are, identify mentors in those spaces, and then work towards that direction. And it's okay to be different. Thank you.
Thank you for that response, Dr. Wala. I think it's definitely evident from what you've said that we shouldn't be scared to think outside the box, and that we should definitely pursue different opportunities and expose ourselves, because there is a place for medicine in multiple areas. So thank you so much for that response.
Sumi, if I may just jump in, can I ask a follow-up question of the panel, please?
Sure.
So I would actually just like to follow up based on the first three set of questions that have been answered. So I think what I've taken away from this so far is that, you know, that we mustn't be afraid to branch out and find different career paths that might still be related or completely or not related to clinical work. However, intuitively to me, it seems that the greatest barrier to that would be the ability to communicate. I think when you finish your studies to become a doctor working in clinical practice, it seems like your way of communicating to, let's say, people in politics for Dr. Chanda, or in business for, you know, Dr. Wala, or even in different areas of academia for Dr. Mokape, it seems like that might be a barrier. So I'm curious if any of the panelists have any advice on how to develop the skills to communicate a little bit more widely that are needed to actually then break into different specialties and you know, start businesses and work in politics and things like that.
Let me start. I would say, I think for this current generation, you have a lot on your side. The first one is the fact that you have the internet, that you have the capability to just read widely, understand, plug into fora like this ones, get to interact with people beyond your space, because those are the spaces that open up. Volunteer for things. I remember in undergraduate and post and after medical school, you know, I started volunteering in my medical association in positions, and those spaces offered me a lot of networking opportunities. They offered me opportunities to see how people present in conferences, what people write, what's trending. So just be in those spaces, be found in those spaces, read about those spaces, reach out, see someone, check out your LinkedIn. You're not too young to have a LinkedIn account. Put your profile there, reach out to groups that are aligned to your passions. There's so many people willing to hold your hand. And then also expose yourself to trainings that are not clinical. And I think this is one thing that I like telling doctors. I actually have a company called Beyond the Stethoscope, which we equip doctors with things that are not clinical at all. And that's one of the gaps that I think at least doctors in our country face, that they're not financially literate, most of them, or they don't know about politics, they don't know about communications or business, and you know, the regulator is coming after them because they didn't put systems in place in their clinical practices. So open up yourself. There are free courses online. Coursera is one of the platforms. Some of these universities offer some of these courses. So just educate yourself in topics that are related, communication, watch, learn, practice. And I think it's something that is acquired, and just acquired by watching, listening, and also by practicing. Thank you.
Thank you, Dr. Wala. Dr. Chanda or Dr. Mokape, would you care to answer that question?
Yes,
yeah, I can go on.
Oh, okay, I guess.
Dr. Chanda, would you mind going first, I think?
Okay, yeah. No, thank you so much. I think, Dr. Wala has elaborated on basically how a medical doctor can communicate to the outside world. I think, like I said in my opening remarks, doctors don't exist, like on some island somewhere. We are part of the bigger society. You know, so if you are part of the bigger society, you need to be a bridge build, make relationships, you know, and I know it doesn't come natural. I think Dr. Wala mentioned something very important, the role of the internet. When I was a student at University of Zambia, 92 to 1998, there was no internet. So we used to Google, there was no WhatsApp, there was no Telegram, there was nothing. So the only source of information was going to a big library, getting a big book, and then trying to find some information. But I think today's medical students have a lot of advantage because the whole world is just in your hands. Yeah, Google is there. You can get all the information, all the profiles about the great people, how to communicate, how to do anything, because the goodness of the internet, it has information just about everything. Just Google, how can I be a best communicator? You find a lot of lectures, which is just take your pick, you know, hopefully you don't take something that is very misleading, but at least you have an option to choose. But the second thing that I would love to say, apart from the internet and all that, is that, look, confidence. Someone told me that the best attire that you have to wear in the morning when you wake up, before you wear anything else, is confidence. Just be confident, because I think, like I said, medical doctors, in my own experience, because I've interacted a lot with medical doctors, lawyers, businessmen, teachers, all sorts of professions, and I've worked with them in all these international organizations. One thing that you find, for example, I'll give you lawyers. Lawyers are very confident people, because the whole career, the legal fraternity, is just about talking. You don't find a lawyer with a surgical dating someone or making a prescription. It's the best guy who makes the best argument, who wins the case in court. So that is why mostly lawyers will make very good politicians. And even in Zambia, if you look at the presidents that we have had, I think quite a number of lawyers, businessmen, teachers. It's very difficult to even think of a doctor as a president in Zambia. Yeah, so because the medical profession confines you training to your ward, to your patient. We are too polite. Medicine makes you actually very, very polite, especially if you are not polite. So what I would urge medical students is that be daring, take risks. You know, I think I would give myself as an example, because once upon a time, I was also very polite, actually, you know, but the situations demanded that sometimes I think being too polite doesn't solve any problems. That when you have an abscess, oil. I mean, the only treatment that I was taught in surgery, if there is somewhere, it's I&D, incision and drainage. You don't start massaging a boil. Once you start massaging a boil, an abscess, you're going to have complications. So it's what we call rough kindness, to cut and drain. It's painful, temporary pain, but permanent pleasure. So to me, that has been the approach. Let's be more daring, let's be more confident. And then, of course, it's our involvement, because you see, medicine, especially medical medicine, has a way of confining someone to a health institution and a ward probably. I know of some of my colleagues who have been in the same ward for the past 20 years. They have never had. So, for example, with due respect, Mukape is an obstetrician gynecologist, but at least to his credit, he has diversified. He's both an academician, obs and gyn. He can do a lot of other things. But other people just have one specialty. If you left them in 1998 in the same ward, find them 20, 30 years later in the same ward. Yeah, so I think to me, again, once we understand that what we're dealing with are bigger issues, I don't know, medical students, whether it's now in career, what World Health Organization calls the 6 building blocks of the healthcare system. It was not in the syllabus when I was a student. We never learned about health system strengthening, because all we were trained about was clinical medicine, later on a bit of community medicine. But when you look at the building blocks of a healthcare system, as World Health Organization defines it, you have all the 6 components there. And I think a medical student, a medical doctor has to understand that. The first one is leadership and governance. Second one, service delivery. Third one, it's healthcare financing. The fourth is the health workforce, who are ourselves, human resources for health. Then, of course, we have the medical products, like medicines, medical supplies, vaccines. And then, of course, we have the health information systems. So all those 6, you need to know how to operate them. But the only way that you will know is by interacting with professionals in all those areas. So I don't see, when I served as chairman of the Parliamentary Committee on Health at the parliament in Zambia, I don't remember getting any medical students as witnesses. That's what we call them at parliament. Even when very important bills were coming to parliament, I can give you a very important bill, the National Health Insurance Bill, which has established NEMA. That came before my committee, the Parliamentary Committee on Health. And then we summoned even members of the public to come and make submissions. How should health insurance work in Zambia? No single representation from among medical students, because see, it's not your training. Yet when you become a doctor, that's what you're going to be confronted with. Like, oh, this patient has no health coverage or not. The other key, legislation which I would have expected, to have representation even from medical students or UNZAMEDSA itself, was when we were establishing ZAMSA, from Medical Stores Limited to the Zambia Medicines and Med Supply. We're talking about the supply chain management. How do we ensure that the hospitals that we're working in have enough drugs, medical supplies, medical equipment is functioning? That is ZAMSA, which is the medical store. So I don't even know how many medical students have been to ZAMSA to look at what happens there, because that is the system that is going to determine how successful you are. So I would urge medical students and medical doctors in general, make it a habit. Go to parliament when there are topical issues. You can access the website for parliament. You see what they call the order paper, which bills are coming up. You are free. You can actually come to parliament in the public gallery. Everyone is free to come there, see the discussion, the way it's going. At Parliamentary Committee on Health, you can appear as a witness, make your submissions, interact with the Minister of Health, the technocrats who are there, Zambia National Public Health Institute. I think the more you understand the whole system, the better for it. Otherwise, you'll be working in a vacuum and then frustrated by everything else that goes around you. I think that's what I would say.
Great, thank you, sir. Dr. Makape, would you like to respond quickly?
Yes, please. Thank you very much, Devon. Thank you. I think I concur with both Dr. Wala and Dr. Jonas Chanda for their responses. I would just want to add one or two things there. I understand MBCHB is quite heavy. It's a heavy program. I think everyone knows that. Especially in the preclinical years, third year, fourth year, it's quite heavy. Human anatomy, physiology, biochemistry, all those courses. And so sometimes I think students, they just focus on those courses. But I think exposure is also very important. Just like Dr. Chanda, Dr. Wala has mentioned, I think you need to find time in your busy schedule, find time and be able to navigate through, especially when you are maybe in the clinical years. I know preclinical might be a bit of a challenge because that's when you are trying to understand the program. But once you cross over, I think you can take that advantage and start to be exposed. I was privileged to be one of the members for the team that reviewed the curriculum, the MBCHB curriculum in Siavonga a few months ago, changing it from a 7-year program to a 6-year program. And we added courses like leadership, we added courses like communication, because and also even entrepreneurship, because we realized that was a big gap in the medical training. When doctors graduate, they don't have skills in leadership, they don't have, communication skills is lacking, entrepreneurship skills are lacking, and so on. Yeah, so those courses, have been introduced. And so I urge every student to take advantage and be able to be exposed. Yeah, thank you very much.
Okay, thank you so much for those responses. I think definitely what I've gotten from all of this is that it's important for us as medical students to be multifaceted and to definitely make exposure a priority to us. Okay, so I think at this point, we're going to take a question from the audience. So I can see that Dora has raised her hand. So Dora, could you unmute yourself and ask your question?
Good evening. So my name is Dora Miato, a fourth-year medical student from the University of Zambia. So my question is directed to the panel. And Dr. Wala mentions that we should identify mentors within our space so that we have someone to talk to every time we want to venture into something or anything of that sort. So my question is, how do you identify a mentor, or how do you find mentors? From the question is directed to the panel. Thank you.
All right, thank you, Dora, for your question. So I think Dr. Wala, you can go ahead and attempt that question, and then I will throw it back to the other panelists.
Okay, thank you, Dora. So I would say maybe at your level in terms of 4th year or maybe 5th year, you may not want to be super specialized into something. So maybe give yourself 2 or 3 areas that you think are of interest, especially given that there are some sections in the clinical rotation you may not have passed through. So once you've understood, allow yourself not to be a specialist at this age. Allow yourself to experience every stage. I like journaling. I'm a blogger, so I write my feelings down, and sometimes upon reflection, I realize you can see there's a pattern of thoughts or ideas that are, starting to emerge from what you write, because then it's stemming from deep inside you. I've also benefited a lot from executive coaching. In my career, there's a level I'd reached where I needed that. And a coach really helps. I don't know whether in your undergrad university, these services are available from the university. If not, it will be something you might consider investing if you feel you're in, like a crossroad, you don't know whether to turn right or left. A third party would help you navigate. And that third party doesn't really have to be someone in the health space. A coach should be able to help you navigate anything, as long as the principles are the same. They help you to identify what is in you, what is maybe you're seeing the barrier, and how to get over the barrier. And then later on, when you're now out of internship, I don't know if Zambia, you go through internship period, because there it's mandatory for you to have gone through it, and then you get your certification. Then you're able to tell, okay, where next from here? Because the real world in internship is very different from your undergraduate training. So again, that's a space where maybe you went in with a very clear direction from medical school, and internship just shows you other things. But again, as I said, build your social capital. So social capital is about the people that you know. And being an undergraduate, volunteer in those university associations, volunteer in your community associations, volunteer in your neighborhood associations, volunteer in your medical association, because I don't know the example, you have a branch for students. In Kenya, we have a branch for students, because those are the spaces that now you start getting to know a couple of people here and there, and the opportunities that will present themselves, but you need to be present in those spaces. Thank you.
Thank you so much for that response, Dr. Wala. Dora, I hope Dr. Wala has answered your question, but I think I'll also allow Dr. Chanda to come in at this point, so that maybe he can also share his thoughts on the same. Dr. Chanda.
Yeah, no, thank you so much. I think the question by Dora is very, very cardinal, because that's a question that many people struggle with. How do you identify a mentor? Who should be your mentor, mentor-mentee relationship? And the truth of the matter is that most of the people that want to identify as mentors are very busy, Like, for example, for me, like when I was Minister of Health, I mean, someone would want to identify me as a mentor, but truth be told, I rarely had time. I would sleep at 4 a.m., wake up at 6 a.m., the day starts. But I think from my experience, there are 2 ways in which you can identify mentors. Physically, you can have a mentor that, although it be very difficult, but also from a distance, you can identify mentors from a distance. I mean, your role models, who do you want to be like? And I can give you examples. For me, throughout my medical career, there are maybe 3 or 4 lecturers that, I put as my mentors. These are the people that, who role modeled me without probably them knowing that they were role modeling me. The late Professor Chintu, may he so rest in peace, pediatrics. One reason I liked Professor Chintu is that when I was a 5th year medical student, and I remember it was a long case, clinical exam, pediatrics, a child with TB, with neurological complications, and I did all the base, the history, the clerking, and everything, and I thought this would be like, a walkover case. Then when Prof. Chintu came to ask me to examine me in that long case, He just told me, put away all your papers, your stethoscopes, your patella hammers. Then he just asked me one question. As a fifth year clinical medical student in pediatrics at UTH, he just asked me one question. You are the Minister of Health. What is your government policy over such cases? I was doing a clinical case. He was asking me a policy question. And as a fifth year medical student, I can tell you I was so confused because initially I thought he was joking. Is he kidding? This is a clinical case. But he told me, you are Minister of Health. What is your government policy over such cases? Then I started scratching my head. I said, no, I would make sure that drugs come. I bring drugs to UTH. Have you ever seen a Minister of Health bring drugs to UTH? No, I'll make sure that Medical Stores Limited does this. I mean, he took me down the road where, I mean, later on, I had no idea then I would even end up being Minister of Health. But Professor Chindu got me thinking that when you see a patient, it's more than a clinical case. It's look at the whole system, because you may have a TB case, neurological, but there, like I said about the system, do we have the right supplies, medical, the equipment, and all that? Which other entities outside your control as a doctor are in? So, in short, I identified him as a mentor, and I made sure that I attended most of his tutorials, lectures. He had that kind of thinking because he's one person who would tell us that he wished a day would come where he would chase all the medical students from Ridgeway campus and then bring in all the street guys from Cairo Road. He said those guys would make better doctors than us because he was saying they are street smart, they are more practical, they are more hands-on. So from Professor Chintu, I learned being hands-on, being a critical thinker, not confining myself to a box. And there are a few others. I can mention Professor Kraiko. I don't know whether he's still there in the Department of Surgery. Professor Kraiko was one no-nonsense disciplinarian as a surgeon, and I just loved him. I was not in his fame, I was in white fame, he was eating yellow fame, but I made sure that I usually get crushed, most of his tutorials and all that. So those were silent mentors who have in a way shaped me. We have the late Professor Makulu, the first dean of the School of Medicine at Ridgeway campus. He was also a character, and most of these mentors I identified personally are people who felt what I really felt. Tough people, practical, critical thinkers. And then, I mean, the other way is you have to read about your models. I can give you an example in politics. If I want to be a good politician, I may not have the chance to meet all the historical figures who have lived on this planet. Nelson Mandela, I just saw him from a distance when I was in first year. When he came to University of Zambia, he was not even president of South Africa. But from a distance, I had to do a lot of reading about him. Long Walk to Freedom, his book, reading it cover to cover. Who is he? I mean, he talked to us maybe for 10 minutes, but everything else, you have to do research on your own. So identify who your mentors are, admire them from a distance, get some values, read about them, and then you try to live that. Then lastly, benchmark yourself with the best. I think when you're identifying mentors, don't go for mediocrity. Who is the best in the field that you want to be? So for example, if you want to be a pathologist, I mean, who is the best pathologist that you can think of in Africa globally? That comes like your benchmark, and do a lot of reading about them. I mean, this generation blessed with the internet has no excuses. For us, we had no internet, we had a lot of excuses. So you Google and go on YouTube, you can watch just about any mentor, both living and dead, in your particular area. So I think to me, that is the issue of mentorship. Yeah, just make it a priority, physically, virtually, and just get it. Thank you so much.
Wow, thank you, Dr. Chanda. That was a very interesting response. Okay, so I'll allow Dr. Mukape to also respond to Dora's question about identifying a mentor. Dr. Mukape.
Thank you, Sumi. Yeah, so that question from Dora, I think it's an important question. It's a question that, basically it's about our practice of medicine. We learn from our seniors, from the people around us. So it's basically a apprenticeship. So you learn from what your seniors do. Okay, so identifying a mentor, I think Dr. Chanda has already highlighted how to identify, but all I can add is that I think you need to approach people, those who are approachable. I guess everyone would want to be approachable. It's just maybe they are busy or something. But if you find an opportunity to approach and someone is able to respond, okay, then I think you just stick to that and you follow what your mentor is doing. I think that is important. Yeah.
All right, thank you so much for that, Dr. Mukape. Dr. Mukape, I'm told you have to leave this meeting at 8 p.m. So I would like for you to maybe just give your final remarks, maybe just a few words of advice before you leave.
Okay, thank you very much. Yeah, I'm sorry I have to leave the meeting. I think I'm on call, so I think everyone would understand what that means, especially in our department of obstetrics and gyne. When you're on call, you can be called anytime. It's the emergencies. Yeah, so, but all I can say that thank you very much for inviting me to be part of this panel and having this opportunity to share what I can share and so that students and they can be able to see through, to see what they can do, and in a way I would just want to encourage students to work hard, be exposed. I think exposure is quite important. It's one thing that is lacking in medical training. So you just need to be exposed to various, even outside medicine. If you're able to add even a program while doing an MBCHB, maybe you can do MBA. If you're able to do that, please do, because that will give you much exposure, okay? I know of some 60th year students who are also doing MPH, and that is commendable. Okay, so while they are doing the MBCHB, they are also doing MPH. Yeah, so get the exposure. Yeah, I think those are my few remarks. Yeah. Thank you
so much, Dr. Mukape, for sparing your time to come and have this chat with us. Thank you for allowing us to get to know you a little bit better as well. Okay, so thank you once again. Goodbye. Have a great working evening.
Sure. I would have loved to be, to be part of the panel until the end of the program, but unfortunately, I have to go. Sorry.
No, you have
Thank
to
you,
save our
Doctor.
mothers.
Thank you.
Yeah, exactly.
Thank you.
Thank you very much.
Okay.
All right, thank you so much again for the responses to Dora's question. So I'll take another question from the chat. So Favor asked to say, what makes a great doctor? So Dr. Wala, would you like to address that question?
That's a tricky one. I think when we were being trained in undergraduate, we were told there's no first class and second class doctor. And so you either had a pass or a fail. So I think for me, the softer skills are what make a great doctor, not the academics. So for example, how do you treat your patient? How do you treat your colleagues? How do you treat your community at large? Because that is where the world is going towards. Actually, in quality of services, we've moved from quality to patient experience. So yes, you delivered a mother, she's fine, the child came out 10 over 10, but what was the mother's experience in your hands? And so Maya Angelou, who is one of the people I look up to, said it's not what you told people, but how you made them feel that matters. So for me, the softer side, the communication, the attitude, the punctuality, I think for me it's a pet peeve when people don't keep time. How do you carry yourself as a doctor? So all these things, because everyone else has an MBCHB. How do you present yourself, your confidence, your integrity? What kind of legacy do you want to leave behind? I think that's what makes a great doctor. Thank you.
Thank you for that, Dr. Wala. Dr. Chanda, would you like to tell us what, in your opinion, makes a great doctor?
Yeah, maybe the definition is who is a great doctor, what constitutes a great doctor. That's what we should start from, because I think there's a reason why the MBCHB, and these things have changed now. The MBCHB was not graded in terms of who graduated with a distinction, a merit, a credit, a pass, and all that. I think that's still the case, and there's a reason why that was done. Because in the end, we are going to care about human beings. And I thank Dr. Wala for quoting Maya Angelou, because she's the one I wanted to quote. And the direct quote is Maya Angelou said that people forget what you did for them. People will forget what you said, but they will never forget how you made them feel. So human beings never forget how you made them feel. They forget the good words, they'll forget the good deeds, but how you made them feel. So if you're a doctor, you make a patient very unwell, they feel like they have to run by going back to home. That they will carry for the rest of their lives. And that is the definition of doctors. They will say doctors are very bad people. Doctors are drunkards. Doctors are this. Because now it's like a stigma. You are stigmatizing the profession. So I think a great doctor or a good doctor is someone who feels, empathy. We call it empathy. Feel for the patient. Patients are not cases. I know as medical students, though I have a case of diabetes, I have a case of, CA civics, I have a case. So yes, cases are there academically, but when actual human beings, they are not cases. They are people with feelings. I remember, I'll give you a very practical example. In my 7th year final exam in surgery, I was given a guy to be, my so-called long case, and he had hyperthyroidism, all the symptoms of hyperthyroidism. He was, hypermetabolism basically, because of the lot of thyroxine being produced. And we know that, in surgery, it doesn't matter whether the problem is on the throat with everything else, the pulse is running like something else. You have to do a rectal exam, a PRI, rectal exam. So this guy was very educated. He was actually a banker from Livingston, and that was 98. So when I told him, like, okay, I've finished all this, I want to do a rectal exam on you, he just outrightly, playing with me. In fact, using the colloquium, you can't be playing with my ass, not with the rectum, with my ass, because I said, why? When the doctors examined me, now you're a medical student, you also want to examine me? No, I can't allow it. And I just had to reach, and Professor Kraiko and some examiner came. That's what I told them. I wish to report that the patient are politely declined to undergo a rectal exam. We have to respect the patients are right. So I think when you feel for people, there are some cases, that I handled years back that I've never forgotten. Like a young boy dying of cancer, which has metastasized all over the body, in the lungs, he's struggling for breath. I'm examining him, he's clinging to me, screaming, I'll die, about to die. And I'm telling me, you're not dying, you'll be okay. Talking to the family, being with them. That goes beyond clinical skills, because they're also rude doctors. If you have great doctors, you also have very bad doctors who shout at patients, who tell off patients. But I think a great doctor is a human being, like Dr. Wala said, who feels, who has human values. I mean, just almost a month ago, my own mother was undergoing an operation at UTH, thyroidectomy, removal of the goiter. But I remember when I was Minister of Health, when I came to UTH, the theaters were not working. They were dilapidated, and no cases were being done there. And I had to make sure that those theaters were up and running without knowing that maybe 6-7 months later, my own mother would be operated in there. So the motive was to do it for patients. Why should patients be on a long waiting list? Because theaters are not working. And then the policymakers have diverted attention to other things. Yes, COVID, but COVID does not substitute for all the health problems that are killing people in our country or in the health sector. So I think, to me, just be human, have feelings. And what makes a great doctor is also what makes a great leader. Just feel for people. If you can put people ahead of you, then you're going to be a great doctor. Thank you so much.
Thank you so much for those responses. I'm definitely learning a lot, and I think I'm not speaking for myself when I say that. So because we are running out of time, I will take 2 more questions from the audience. So I'll allow McLeod James to ask his question, and then only either Dr. Wala or Dr. Chanda will respond to the question. So McLeod James, you can.
Hello, good evening, Dr. Chanda and Dr. Wara. I'm a fifth-year student from Osaka. Yes, my question is, I just want to find out, because in my clinical rotation, I always hear about either students and doctors themselves trying to rather downgrade or say something about certain students from different schools. So my question is there bad schools where training of medical doctors are concerned, be it local or abroad? Because I normally see, or rather hear, doctors say, no, this one is from country B, don't worry, don't get mind, or this one is from this university. Are there bad universities that produce bad doctors? Thank you.
Okay, so Dr. Wala or Dr. Chanda, is there any one of you that would like to, which one of you would like to address this question?
I think Dr. Chanda, you can go ahead. So then I hear the Zambian experience, because we have the same
Thank you so
exact
much.
thing
I
in
almost
Kenya.
said let it face. I wanted to say let it face. There's still a few gentlemen around. Yeah, but thank you so much. I'll be very brief. You know, again, it's the nature of human beings, you know. Yeah, so look, people always compare who is better than who. Even among countries, right? You go, I mean, you see what is happening in Ukraine. In Ukraine, when the war broke out, you know, refugees were running towards Poland and these other countries. Black students were being stigmatized against. They couldn't be allowed to enter Poland. They were anyone who is not black were entering. That is the nature of human beings who have these biases, the stereotypes and all that. Yeah, but what I would urge you, you know, is that don't get so much defined by stereotypes. Like, you know, if you come from this country, if you are trained in Cuba, because that's what we were told when I was a medical student, is that people trained in Cuba or Russia, they don't make good doctors because they are not allowed to handle patients. But yet I've seen some of the best doctors that I've worked with are actually people that were trained in those countries, in Cuba, in Russia. So in the end, it comes to the human being. And then also appreciate the history of Zambia. You know, Zambia is not like Kenya. Kenya is a bigger country. Nigeria, I've worked in Nigeria. Nigeria has, I don't know how many medical schools, maybe 30, 40 medical schools. While in Zambia, for many years, we only had one medical school, the regional campus. So of that, it was actually one class, one intake with the time I was trained. So it was very strange, actually, for people to be told that there will be other medical schools opening. Unilas itself, this Apex University, you know, I mean, in Ndola, I'm actually neighbors with the Copperbelt School of Medicine. So it was very strange, like how can other medical schools open when the only one, the Vatican of Medicine, visual campus? So that is why you get that talk, right? But that talk should not deter you. In the end, what will make you a great doctor, as we were saying in the previous question, is just who you are as the individual, the knowledge that you acquire, and the skills that you apply, and the way you feel for your patients. Because I can tell you, like at Apex University, some of the best doctors that I know who are trained at regional campus and for postgraduate outside, they are now lecturers at Apex University. So what will make a student at Apex when they're taught by the best? I would say one time I had a bout of kidney stones in 2010s. The urologist who treated me, I think Dr. Boa, Professor Boa now, he should be at Apex, you know, and very, very good. So anyone who passes through their hands will be excellent. So don't allow anyone to define you, to box you in. You have to define yourself. And I think that's what I would say. Thank you.
That's a great response. Thank you so much, Dr. Chanda. Okay, so we'll take our last question. So I saw Mwinji's hand was up, but it appears to not be up anymore. So just give me a second so I can find a question from the chat. Okay, so I will ask Ghislaine's question. So it says, how do you balance working as a doctor and your personal life with family life or social life? Dr. Wala, could you take a go at that question, please?
Thank you. So with a disclaimer that I'm not in clinical practice, which is And whichever field you are in, it's important to see how to integrate. Nowadays, they talk about work-life integration and not balance, because balance is totally unachievable. I would say I have compartments in my life. I hear it's only men who think like that. So here is a woman who has compartments in terms of if right from the time I was in medical school, I ensured that I did my best to get all the knowledge I could up to Friday. And Friday evening up to Sunday, I was never in medical school. I was out visiting family. I was out doing youth activities. I was basically out there in the world, interacting with non-medical people. And I still ended up passing my exam without any retakes. And I think it's just about what do you do in, there's something they call be present, be here now. You know, for example, you are in class, but you're not in class. So if you're able to dedicate and focus on their task at hand and prioritize the things that you need to do, such that by the time that period or that you're supposed to be undertaking that task, you've accomplished what you need to do, then you're able to have other things. I was also very deliberate to have friends who were not in medical school, because it's very easy to reinfect each other, if for lack of a better word, with that medical thinking, with that boxed kind of thinking. So have friends in the arts courses, have friends in other science courses, have friends who are not in university, just get to be exposed to other spheres of life. When I started working, I also had the same principles. When I was at work, I focused on my work, and when I was at home, I was at home, even when I had children. For those of you who would get to be parents, it's going to be very, very tough, especially if the children are young. And for me, what worked is that I learned to delegate a lot. So I empowered, here we have nannies, good ones, and interesting ones. I learned to empower my nanny because I had a traveling job right from the beginning. So it meant that there will be times I wasn't going to be at home. So I think it's important to understand that you can't be a superhuman being. I'm also very passionate about mental health of doctors. I think we suffer from burnout and we don't admit, and so we take our pressure to other things like drug and alcohol abuse, as well as triggering other mental health conditions. So have fun, create time to go dancing. Every Friday, I used to go dancing before COVID hit us. And it was my me time, yeah? And then there will be a day in the week, I think it's Sundays, when I'm with my children and I don't allow anything else is there. If it comes to traveling, I would make sure that my travel is during the week so that weekends I'm at home. But I think invest in even an accountability partner, someone who will tell you, oh, today you sound a bit off, like you're maybe down or you're snapping, because those are some of the triggers for burnout. So it's important to know, and it's very, very important to be vulnerable and to ask for help. So you are not immune to mental health issues. You're not immune to burnout. You're not immune to stress. You will still go through the hassles of life that other people go through, and the pressure of a very, very high risk environments by being a doctor. So just know that you're a higher risk in terms of getting some of these mental health issues. And I hope the university has a professional line for counseling. It has, counselors on the, available to you. If not, reach out to your colleagues. Colleagues usually don't charge, so reach out to a teacher. If someone points out something, most likely there's something going on. So be vulnerable enough to say, I need help. And if you need to take a pause from school, please do. School will still be there 2 years to come, but your life is more precious than, pushing yourself when you feel you just need to take a break. Thank you.
Thank you so much for that, Dr. Wala. You reminded us about some very important things that I think being busy with medical school can cause us to forget. So I think at this point, we're going to wind up our discussion. So I will allow the panelists to just give their closing remarks. But before we do that, I think I would just like to quickly go through some things that at least I've been able to pick up from this meeting, just for the sake of those that may have joined late or for those that had internet connectivity problems. So first things first, make time to go dancing. Everybody is prone to developing mental health problems. We are not immune. And then also, we should definitely learn to push ourselves and be exposed. Just go for those volunteering opportunities. Also be organized and plan. It's the only way that you can balance your time and sort of like remain on top of things. Also, don't be defined by stereotypes. And what makes a good doctor is, above all, you being human and feeling for your patients. And so thank you so much again to everybody that joined. Thank you for your questions. Thank you for listening. Thank you for staying. Thank you so much to Dr. Chanda and Dr. Wala, who spared time to come and speak with us today and have this very interesting chat. So I think I'll just allow Dr. Chanda first to give his closing remarks, just any advice that he'd like to give us, and then Dr. Wala will follow after. Dr. Chanda. Hello, Dr. Chanda, are you there?
I think he's frozen, so I can go.
Okay, no problem, Dr. Wala, please go ahead.
Okay, thank you. I think my parting shot is it's okay to be human. You're not a god, despite what society may tell you. And I think because we've come from a space where maybe you've been the top of your class in your high school, or your lower years, and that expectation to always succeed weighs heavily on medical students, on medical doctors. And I think it's for me, it's okay to fail. It's okay to say I didn't make it. It's okay to say I need help. I think that's my bottom line, because I feel doctors are very, very, they hold on to things, and, they feel they need to, there's that pressure to succeed. And that pressure can be very lethal, and it can affect you. And it has costed us in Kenya. Doctors are committing suicide. Doctors are, being admitted in mental health institutions. Doctors are injecting drugs from theater. So I just want to say, if I can touch someone's life today, that it's okay to ask for help. You're not a superhuman being. You're just a vessel to be used to take care of others. Please remember to take care of yourself. Thank you.
Thank you, Dr. Wala. Dr. Chanda, can you hear me?
I think he unfortunately dropped off the call.
Okay, so unfortunately, Dr. Chanda isn't here. Hopefully, he'll join as maybe Devon comes in and maybe gives some of his closing remarks as well. Devon, would you like to say something before we close off the meeting?
I don't have anything too much. Thank you again, Dr. Wala. Thank you, Sumi. I think this has been a very a fantastic discussion from One Day Africa's side, and exactly what I think we would have hoped to achieve with this discussion. So thank you both again, Sumi, and also thank you to Danny, who does all the tech in the background. Her work maybe goes a little bit unnoticed, but it's certainly felt by us who have to speak. So thank you, Danny. Thank you, Sumi. Your work has been fantastic as well. And again, thank you, Dr. Wala.
Okay, great. So thank you to everybody once again. Thank you to everybody in the background. Thank you to the One Day Africa team. Thank you to the UNZAMEDSA team. Thank you so much, especially to the panelists and the attendees. Good night, everybody. We're free to log out now.
Good night.